Hey guys, this is Ruben with Indus. Couple of questions. What is the problem that you're trying to solve?
Our company, Health Fidelity, is very much focused on taking next generation technologies in healthcare and improving patient care. Patient comes into a clinic. Right now they don't know whether they're receiving the optimal care or not. By unlocking all the information, all the data in the healthcare system, we can assure the patient gets the best care from the best doctor in the best way possible.
And with the new frameworks of consumer privacy, how is it that you guys are able to operate?
We take that very seriously. The next generation or second generation healthcare technology companies recognize that older generation technologies had security risks, may not have been focused on privacy. The new generation technologies are entirely built around addressing the regulatory framework and ideally surpassing it. So we keep the information perfectly secure, perfectly transmissible, and shared with the right people at the right time.
I see. And another question is, how is it that you guys are able to take all this big data and to allow the collective decision-making process to improve?
That's the hard part in healthcare. You have a doctor here, a doctor there, they know different things. Bringing these groups together and addressing the individual patient that may have 5 different disorders that all conflict. Being able to bring the data together, communicate it clearly, and personalize the care for that patient is the challenge. Our company and other leading companies in the field are very much focused on that challenge.
I see, very good. And who are some of the customers or some of the clients that you guys work with right now?
We work with the largest health systems and the largest vendors in the space. These groups come to us and say, we have so much information, we don't know how to manage it, we don't know how to extract it and make it meaningful. We work very closely in the personalized way that healthcare requires to pull the information out, make it actionable for these large groups of health systems and vendors.
I see. And you have a very interesting background because you have an MD and you also have an MBA, so you have sort of access to a lot of information from the health side and also the business side. What are some of the challenges that you have faced in your career to try to sort of project forward with innovation and technology?
Medicine tends to be very focused on a doctor addressing a patient's need. When a doctor tends to branch out, when they have a personality that wants to work more in policy or technology like I have, it seems unusual. With that said, medicine has become more and more accepting of that kind of physician that wants to improve patients' experience, not just one patient at a time, but globally at a population level. It's been a real pleasure to be able to both be a practicing doctor and also address population level policy and technology needs.
Great. A last question. So what is your vision of the future with regards to technology, innovation, data, and health?
I think it's not set in stone. I think the choices that are being made at the national level and at the regional level are truly influencing what we'll experience in 5 and 10 years. My hope is that the field will embrace big data, will extract out the information properly, and will use it to personalize care for each individual patient. I believe that there's a chance that that can happen if we all work diligently toward that future.
Great. Well, thank you so much for your time. Really appreciate it.
I enjoyed talking
Thanks.
with you.